From NY Polls. Hello, Chike. Welcome to the program.
Hi, Nancy. Thanks.
Hi.
Thank you.
Hi. Speak to me about this malaria pool, an economic burden. How much of an economic burden is it? Because I know that some people will start saying, Nancy, what are you discussing malaria again on this show? You know, some people will be like, hey, is it not sports? Is it not face your forte? And I'm like, okay, I won't be angry. I'm just going to educate you in terms of everything affects the economy. Is the economy, like the Americans say, is the economy stupid?
I think, a lot of times people look at health from a different perspective. People forget that health is wealth and that health has a huge impact on the economy of a country. As in, there are things that, there are things like you have to be healthy for you to be able to move your economy forward. If you actually invest in health, you're investing in your economy, because who are the drivers of the economy? They're human beings like you and I. And if someone is ill, if you have a generally unhealthy population, then it will be difficult for you to be able to make any drive in your economy. There's something that they call growth penalty, as in countries, for example, statistically, countries with high burden of malaria actually have lower performing economies compared to countries that have a lesser burden of malaria, of which Nigeria is. 97% of people in Nigeria are at risk of getting malaria. We live with it, so you can't run away from the fact that malaria is with us. And if like I've said, that countries with high transmission of malaria have a slower performing economy, then it's obvious that if we do want to move our economy forward, we need to tackle malaria and we need to face what it brings. Give me the statistics which you guys have polled. Okay, so
interesting statistics here.
Yeah, so it's a lot of things to pore over. First of all, these are perceptions, because there's a lot of programs for malaria going on in Nigeria, but sometimes you need to ask the people that are receiving these programs, what are their perceptions, what they think about this, and going the fact that the tagline for this year's World Malaria Day was reaching the zero malaria target. We wanted to see what it was like for people. And so this was done the week of April the 12th, and we had gone around asking people. First of all, we did ask people, do they think malaria is prevalent? And 87% of people believe that it's prevalent. But now I'm asking people specifically, have you visited the hospital within the past 3 months? 47% of our respondents said yes, they have been. They personally, we're making this a very personal conversation, not somebody in my family, that they have visited the hospital within the past 3 months. Remember that this was being asked during a COVID era, that people don't actually go. But 47% of our respondents said they went to a hospital. Out of this 47% that went to a hospital in the past 3 months, 83% of them were diagnosed with malaria. Even those that, among the 57% that said that they hadn't gone to a hospital, 45% of them treated for malaria on their own. So within the past 3 months, you can actually see.
Because the common disease is malaria. Feeling headache, I'm sure it's malaria.
Statistically, 60%.
Typhoid is the next cousin.
Typhoid is the junior brother to malaria. But as in statistics, 60% of all outpatient visits in Nigeria are malaria. So it's endemic, it's here, and we need to, yes, with no, not trying to misdirect, there's a COVID pandemic going on, but malaria is endemic with us, and we need to also, give voice to that.
How much have we lost? Because during my intro, I did talk about, how much companies definitely will be losing, not just man hours, productivity, and even money. There's cost to all of this.
The last data that I can confidently speak to was in 2016, that Nigeria had lost as much as 132 billion naira to malaria, both through direct cost and indirect cost. Direct cost in the sense of the cost that goes into maintaining your healthcare infrastructure to be able to manage cases of malaria. So the indirect cost of human labor that is lost from sick leave, as like when someone takes sick leave, it's productivity that is reduced. There's a cost to that. So it's a huge economic burden to the country. And still speaking, just driving back to the poll, it also gives you an idea of how people have, what was the word to use now? When people are, this thing is with me, I know what to do. Of people, when we ask people if you have symptoms of malaria, what do you do? Only 57% said they'll go to a hospital. The rest said, I'll go to a pharmacy, I'll go to a chemist, I'll buy drugs by myself. So people already, as in like, you know, that kind of situation where you're like,
yeah, your own doctor. When
my
it
own
comes to
doctor, what
malaria.
else is malaria? In fact, as in practice,
don't see
then,
people like you again.
in practice, then a patient comes in and you say, what's wrong with you? So I have
Like
malaria.
And
And
you're supposed to be
I'm
the one
like,
to
if you have
diagnose.
malaria, then okay, all right, now what else are we still talking about? So people come on and it's like, you have to tell the person, okay, I've heard you, what exactly is wrong with you, you know? But that's kind of how malaria is. So you can't speak about moving the economy of Nigeria forward without talking about endemic diseases that have a gross effect on our productivity and our economy.
You spoke earlier about, you know, over the years we've seen funds, whooping funds, sums of money targeted at malaria and all of that. Did your poll capture a sense of like how much, because I know it's millions, even billions of dollars.
So we didn't ask that because we're speaking to the general public, but those figures are not, they are publicly available. If you go to the Global Fund website, you see how much has been committed to the malaria component of the ATM grant in Nigeria. I don't know the exact figures, but like you're saying, you're speaking of millions of dollars.
$3 billion in 2019.
So as in like, and we still have malaria. As in people still die from malaria. That same 2016 data points out that about 207,000 deaths were attributed to malaria in Nigeria. And of course, a huge portion of these are towards children that are under 5 years old.
Very important that you brought that.
And you can't, one of the indices that is used to assess the development of a country is its under 5 mortality rate. And Nigeria still has a high under 5 mortality rate. And 30% of these deaths are due to malaria.
So malaria kills more Nigerian children that are under 5?
Yes.
Are there other things that you would like to speak to us around this polls before we close?
Yes, so...
I'm seeing the drugs here. Should we... I don't want us to call names.
No, I don't want us to call names.
Yes, but quite interesting that people will go get those drugs.
Straight up, without people self-diagnose a lot. And the point I wanted to make, like I said, only 57% of people go to hospitals. You have 16% that go to pharmacies when they have symptoms, 15% that goes to chemists. So if you do want to have a comprehensive intervention against malaria in the country, you can't focus on hospital services alone. You need to engage the patent medicine vendors. You need to engage even the community pharmacies so that they kind of be sure that they treat along the algorithm of malaria. There's one point that, because we did ask people, did they have insecticide-treated nets?
I was coming to that.
And 71% said yes, they have nets. Oh,
mosquito nets.
Mosquito nets, which is a plus, is a win, as in like that's the goal. And then we also followed up to ask, did you sleep in it last night? And 67% said yes, they slept in it last night. I personally take that with a pinch of salt, you know, because it's a bit difficult to kind of follow through. But I think the goal is to sleep under a nice insecticide-treated net, and people say they're doing that anyway. So that's one of the quick wins that we can push around that. And let me just point out that all these findings that we kind of found, there was no difference across the geopolitical zones. There weren't different male, female, or there wasn't difference between age groups. So you can't really say, so this is uniform across the country. Apart
from apart from having mosquito nets, did they also talk to you about some other ways to prevent malaria?
Yeah, absolutely. People did mention clearing your environment, keeping your house clean. Some people use insecticide.
Taking off stagnant water.
That's clearing your environment.
Okay.
Don't cutting bushes. Don't allow. In fact, just clearing where water will collect. Things like the gutters around and stuff. But we can't run away from the fact that we have a burden of malaria, and we need to do something about that. My hope for the future is that the malaria vaccine makes its way towards.
You want to enter the vaccine discussion?
towards being available. Maybe that's the way.
The way out.
Yeah.
Thank you very much for coming.
Thanks, Nan.